Thanks so much. I'm so grateful to be here. Today I'm going to talk about the importance of advancing rare disease policy and equity in Latin American countries and the strategies and the solutions I have developed during these 5 years of advocacy to really build the policies and laws, not top down, but bottom up, based on the lived experiences of the patients and their caregivers. So basically, in the Latin American countries, we have a lot of challenges. The first one is that around um, 50 million people live with a rare disease. 50 million people. This is a huge number. 75% of these patients don't have access to a diagnosis. They are undiagnosed rare disease patients. And the care disparity is huge. So although sometimes care exists, so sometimes care is available in the country, but it's very expensive and sometimes it's not even available. So the vast majority of the patients that can afford it, they need to travel to Europe or to the United States to get access to these medicines or diagnosis elsewhere. So this is actually why I became involved in advocacy, because during law school, I'm a lawyer by training, and during law school, I met this girl who lives with cystic fibrosis, and the treatment that would save her life was not available in Brazil. She had to move to Miami to get access to this innovative drug. And I started by understanding that no one needs to be forced to leave their country to stay alive, and therefore I started this campaign to bring orphan drugs to Brazil and to make sure that every patient counts and that every life is worth high quality healthcare and a better life. So this is why I developed these solutions I'm going to talk about right now. The solutions basically are based on the systemic barriers that we face on the countries. The first is the unheard voices of the patients. The laws usually don't understand the policymakers, they don't understand the lived experience of the patients, the caregivers. So therefore, the laws are not based on listening to the patients. The second is the bureaucracy in the country. So sometimes the laws, they are very fancy, they have a lot of bureaucracy, but it doesn't help the pharma companies, it doesn't help the patients. So we need laws that at the same time they provide legal safety and they provide the rights of the patients in a clear manner. And secondly, and thirdly, lastly, the services in Brazil and in other Latin American countries, they don't talk to each other. So there is no a health, no policies approach. So we need to integrate the services, the social services, the education, healthcare, the job market, because they are not right now integrated to each other. So based on this, I really wanted to help the patients in Brazil, and I did these interviews with a lot of patients that I'm going to show you right now a couple of examples of it. The first step I did was listening, because when we listen, we really understand the challenges, the barriers, and the solutions. So we can develop the solutions with them, which links me to the next point. We need to see the patients not, we are doing this policy and laws for the patients, but with them. They are our partners in this policy development. So we need to co-create the policies, the laws with them, because they are the experts. So we need to first listen and co-create the policies with them, and not only with the patients and patient advocacy groups, but with also all the stakeholders, the pharma companies, the doctors, the policymakers, the lawmakers, the caregivers, the siblings, the patients, so all the stakeholders involved, and looking at the holistic support, looking at them not only as patients, but as human beings, as people who also have dreams, have life projects. They have wonderful life stories. They can teach us so much, and I have learned so much from them. So looking at the social determinants of health, looking at that they don't only need access to healthcare, but also need access to high quality education to get the job they have dreamed of, to really be able to live a life they are proud of. And during these interviews I did with dozens of patients in Colombia, Peru, Brazil, Chile, which led to my last paper I published, I met not only numbers, figures, I met people, real people, especially low-income patients. And I met this girl, which the picture is on this slide, Maria Cecilia. Maria Cecilia has 8 years old. She's Brazilian. She lives on a very poor slum in Rio de Janeiro, in Brazil. And her mother is a low-income single mother. A low-income single mother who has depression because she had to leave their job to she had to leave her job to take care of Maria Cecilia, and so taking care of Maria Cecilia is her full-time job, and she has depression and other mental health issues, and she faces hunger as well as Maria Cecilia. They all the time they ask me for milk or for food donations. So understanding the social barriers and understanding that, for instance, one of the barriers for her to access the nearest hospital is the because the bus is so expensive to her. The bus fare is very expensive, so she can't afford to buy the bus tickets to go to the hospital. Or for instance, the Maria Cecilia faces bullying in school, stigma in school, because the school is not accessible to her. Her colleagues don't understand her disease. So I invited them to build the policy with me. I invited them to imagine a better world with me, a better rare disease policy with me, and ask them, how can we build better policies, and what are your policy ideas and solutions and law solutions to build a better health system and a better world for them. And based on these interviews, they gave me wonderful examples, and I united all these examples and I gave them to policymakers in Congress, and it became the a landmark in Brazil, which is called the Rare Diseases Statute, which is here. I'm going to show you. It's called Rare Diseases Statute, and it's a new law based on the real experiences. It was enacted last year, and it is really historical law in Brazil because it provides not only the right to high quality healthcare, but social support to families, and looking at the caregivers, looking helping the families with the job market, with education, with mental health issues. So it really has a whole person approach and whole person support, looking not only to the patient but as them as a human being, and developed by them, with them. And it was so impactful to do it that I invited my co-authors, my colleagues on this journey, including Maria Cecilia, to be with me on the bill signing event in which the bill was enacted into law. So this next picture is me with Maria Cecilia and her mother during the bill signing event, and she's holding the new law in her hand. And I developed this law with them, and I invited them to be with me during all the lawmaking process, all the process, until the law was enacted, and they were there with me on the event that the law was enacted. So it was huge, and I also invited other dozens of patients that were there watching the law being enacted and the law that they are the co-authors. It was very impactful, and this not the end, this just the beginning of developing this framework with the patients as partners on the policymaking process. So we need to close the gap. We need early diagnosis. It needs to be a priority because if you don't have access to diagnosis, you can't go after your treatment and know even the name of your disease. So this is very, very important. Social support, and as I mentioned earlier, families need to have holistic support, and we need to have a health in all policies framework, and look at all the social determinants of health and also enforcement. Of course, laws are very, very important. Policies are very, very important, but we need to enforce them in practice, because at the end of the day, laws are only like written in paper, and they are nothing if they are not enacted, if they don't really impact the lives of the patients, especially the low-income patients who live in low-income cities and need our help. So now our work needs to be to enforce these policies in practice and laws, to make sure that the patients are affected in practice in their real lives. And also, I'm very glad, I was very excited about the invitation that RDI gave me to be one of their young leaders. I was a couple of days ago in Geneva helping them with the WHO resolution on rare diseases. And now we are building the global action plan, the WHO global action plan for rare diseases. It's a 10 years plan, and we are going to build it with the stakeholders. And I'm so proud, I'm so happy to build it with the patients, with the caregivers, and make sure that it is built not for them, but with them. So this is our plan now, to build this WHO Rare Disease Action Plan, and really make an impact not only on the national levels, but also on the global level at the WHO. So to do the summary, we need first to co-create the policies with them, with all the stakeholders, listening to them, the patient advocacy groups, the healthcare teams, pharma companies, the caregivers. So listen to them and co-create the policies with them. Secondly, we need a human-centered approach to really understand that more than patients, there are people, and we need to look at the social determinants of health. We need to not only help them to achieve high quality healthcare, but achieve their dreams, their life projects, health outcomes. And thirdly, we need to stay in touch with them to really make sure that the policies are enacted in practice and they impact their lives, and make sure that if something is not working, we can change it, and also learn from the things are working, that we can change best practices, and make it only the beginning of new laws and new policies, and impact even more the patients' lives. Thank you so much. I'm so honored to be here on this event. Now I'm open to listen to your questions.